Cardiac early detection, as far as Porter Hospital is concerned, is a program that we have for outpatient testing.
Back in 2008, Chief of Police Gerald Whitman had an idea about getting some significant diagnostic testing done for our officers, and one of his priorities were heart scans. Our Denver Police Foundation also did some research into heart scan technology here in the Denver area, and they elected to go with Porter Adventist Hospital. We had an initial meeting with the staff here at Porter and described what our goals were, and Porter Hospital staff described what they could do for us, and we started putting a plan together because we were looking at potentially 1,000 officers that we would try to get through.
The Denver Police Department, I bet if you sat down and talked with any of those individuals, you would find out part of their passion in doing what they do every day is that they love to serve. And many times, those of us who are in the serving professions end up in a place where we take better care of others than we do ourselves sometimes. And so we need reminders of people who come to us and say, well, let's find out just how healthy is your cardiac status. And I think this has been a wonderful opportunity for us to open up that whole population and with our advanced practice nurses and seek to connect with them both as servants in our communities and then in our way of serving them so that they can continue to serve our community.
We've had the opportunity to work with the Denver Police Program through the Heart Healthy Hero program this past year, where these group of individuals are at high risk for developing heart disease. The policemen have been allowed to come through our program and obtain CAT scan testing, and one-on-one the advanced practice nurse has sat down with each individual police officer and counsel them and customize a program for them for follow-up and make recommendations for their heart and remaining healthy.
We've lost officers in the fairly recent past to heart issues, and I want to make certain that that doesn't affect me. Like I said, I'm a very big supporter of this. I think we should have 100% participation in the department to ensure that we don't lose another officer to a heart ailment.
What allows us to provide more dedicated support through the Heart Healthy program is really a direct partnership through a shared mission with the Denver Police Foundation. We see that population as an extremely high-risk population.
Our advanced practice nurses that have such a strong cardiac focus have taken their cardiac knowledge and geared it to the community in terms of wellness and prevention.
As an advanced practice nurse, I was given the opportunity by this hospital to help change the mindset of other leaders at the hospital to not only focus on treating patients through intervention, but also now through cardiac prevention.
Cardiac disease is the #1 killer in our country, and certainly the #1 killer in men, but what most people don't realize, it's the #1 cause of death in women as well. So cardiac early detection is a means to detect coronary artery disease before it causes a problem, before it causes myocardial infarction, a heart attack, or cardiac death.
This program is very innovative in that we offer a means of detection of asymptomatic, so a patient with no symptoms that is walking around with heart disease. Again, we risk stratify our patients, and we help determine which test is best for them, and we'll perform that test and make our recommendations based on that.
Because our nurses are dedicated in terms of their cardiac experience, they offer something that's unique to the community in that the patient comes and gets a test, the latest technology, but we really take it one step further.
We offer a variety of tests from ultrasound of the carotids to CAT scans of the heart to more sophisticated lipid tests to ultrasounds of the heart via echocardiogram. There's a variety of tests that we can utilize based on what the patient's needs are.
One of the things that I really respect of the knowledge of our advanced practice nurses is what they learn on prevention and wellness. And so that whole curriculum they go through on how to keep people well is invaluable.
So when we talk about our cardiac early detection program, it's not only a hospital-based program. There's an education component that allows us to expand our reach into the community. We educate potential patients on how to remain healthy and educate them on risk factors that could potentially lead to an adverse event in their future.
We will sit down with them and counsel them one-on-one and make medication recommendation, lifestyle change, diet recommendations, whatever it is they need.
Our nurse practitioners go over the scans with the patient. They show them pictures. And I'll tell you, just anecdotally, when patients see their arteries and they see plaque within their arteries, that in and of itself will change behavior.
When you are a magnet hospital, you're called on to be innovative and to take what you've learned and to advance the practice of nursing. And I think that is such a role for our advanced practice nurses, and to have them to be able to innovate in a direction of serving our community even further reinforces our mission.
The partnership with the Denver Police Foundation really offers us a very unique opportunity to target our program to those that are most at risk.
With our Heart Healthy Hero program and working with the Denver Police Department, these officers have been allowed to come in on duty and get their CAT scan and get counseling in a very efficient manner.
I would highly recommend this to everybody in the department to go through this, to come down to Porter Hospital, go through this exam. You will not regret it, and you'll have an excellent experience.
Since we've walked through the front door all the way through getting the test done and then the consultation afterward, everybody has put our minds at ease. They've explained the entire program and process to us, and so I have a better understanding of why you get a heart scan and what the results after indicate.
This is the only program of its kind here in North America that I'm aware of, and I'm just really hoping that we can lead by example so that we can help other hospitals and other law enforcement agencies model what we're doing here in Denver, specifically with the heart scan program.
This testing is for everyone in the general public. It is quick, it is painless, and it's affordable.
To offer a cost-effective way for individual members in our community to look at where they are in terms of the health continuum and then really be proactive in the prevention aspect of their health does make an impact.
The program also falls in line with the hospital and corporate mission for providing care to the public.
The Cardiac Early Detection Program is directly aligned with our Centura 2020 strategy in terms of moving upstream. We see prevention and partnering with our community along the full continuum of their lifespan as an important piece. We need to build that trust and that relationship with our community so that when they do have health issues, they know that we will be there to help them through that difficult time in their lives.
Our advanced practice nurses, in the context of our mission in Centura Health and here at Porter, our mission calls on us to nurture the health of those in our communities. And when I think about that in Centura 2020, and I think about the Institute of Medicine report on the future of nursing, our advanced practice nurses are very key people in allowing us to fulfill our Centura 2020 vision, to fulfill our mission, and also for us to be able to provide nursing care in a way that benefits many of those in our community.